Good afternoon, everyone. If you're just joining, we're going to give it just a minute or two for individuals to hop on to the meeting. I see that we still have quite a few people adding, and we know that others may be running from another meeting. So we'll get started just a couple minutes after the hour. Thanks for your patience. Okay, good afternoon, everyone. We'll go ahead and get started. This meeting is also being broadcast on YouTube to accommodate the high number of attendees that we have today, which we're very excited about. So thank you so much for joining us. We appreciate you taking some time during your Friday afternoon lunch hour to join us for our Pathways Stakeholder Update. We are 24 days away from go live and the launch of the Indiana Pathways for Aging program, and our team is incredibly excited to share with you our updates in this space as we've reached a couple really key milestones in the last couple weeks, as well as have continued our day-to-day work as we go closer to program launch. So with that, we're going to cover just a quick overview of the Pathways for Aging program. We know that we have on today's call providers, community organizations, Medicaid members, some of whom are very familiar with the Pathways program, and for some, this may be the first time that they've had the opportunity to hear about this. So we will try to strike the right balance of detailed information as well as sort of walking through the landscape of the overall overview of the program. You can always find more information at in.gov/pathways. So if anything in the contents of today's webinar you'd like to learn more about, feel free to check out that website as a starting point. We'll be covering key information around Pathways enrollment, the MCE plan selection process, where we are today, and where we are as we go forward with July 1st. We'll provide some important updates around care and service coordination, provide some information about our member support services opportunity that will go live on July 1st to help support members in addition to the support they'll be receiving from their managed care entity. We'll spend a good deal of time making sure that any providers who are on today's call have the information and resources that they need, with everything from contracting to our claim submission processes, provide some information about readiness, and again, show you where more information is available from a frequently asked questions standpoint, or for those of you that are interested in having our media toolkit in order to provide information to Medicaid members or patients that you may interact with on a day-to-day basis. So with that, we can go to the next slide. I want to start with an exciting announcement that you may have seen via an FSSA news release, which is that we have received full approval from our federal partners at the Centers for Medicare and Medicaid Services for the launch of the Pathways program and related waiver transition activity. So the first item that we received approval for is our Indiana Pathways for Aging 1915B waiver, which allows us to change our delivery system model to managed care from the fee-for-service model. We also made corresponding changes to the Hoosier Care Connect 1915B waiver to align the age changes in Hoosier Care Connect to be those under 60, so that those individuals age 60 and over are on our Pathways program. And then you may be familiar with our home and community-based services waivers, which include the Pathways for Aging waiver, as well as a number of HCBS waivers that will fall within the operational authority of our Division of Disability and Rehabilitative Services. Those include the CIH waiver, the FSW waiver, TBI waiver, and for individuals who are currently on the aged and disabled waiver, those that are under 60 will be on the new health and wellness waiver, and those over 60 will transition to the Pathways for Aging program and that waiver within the Pathways program. So we're extremely excited. A lot of great discussions with CMS about our readiness and what we want to accomplish with these waivers. We appreciate their support and collaboration as we move forward. Next slide, please. So just a quick level setting opportunity about the goals of our LTSS reform project. So this is at least 3 to 4 years of work that is about to come to fruition. We're very excited about it. But since the beginning of the work that the FSSA undertook in this program, these have been the high-level goals. So improving processes to ensure faster eligibility so that individuals can receive long-term services and supports when they need it. Of course, the transition to Pathways and our managed care delivery system. Paying for outcomes, not transitions. Quality has been a very big focus of our program. Ensuring that LTSS data flows the best that it can. Our workforce work, particularly as it relates to the direct care workforce, has been incredibly important to this work. The Direct Care Workforce Advisory Board has been recognized nationally, and we're very proud of the work that we've done there with the Bowen Center, led by my colleague Peggy Welch. The home health roadmap continues to be an area where we're spending time thinking through how best to integrate state plan services with those that individuals receive in home and community-based service settings under the waiver. And again, that waiver integration work and the work that we're doing, again, with the other HCBS waivers that will continue to be operated by the DDRS team. So with that, we can go to the next slide. And I am pleased to pass it to my colleague, Kim Brimmer, who will provide some additional overview information about the Pathways program.
Thank you, Cora. My name is Kim Brimmer. I'm the Director of Pathways for Indiana Aging. And I kind of want to start with a high overview. As we said, we have several people that have already heard this, but then others may not. The MLTSS, you'll see that all over the place, stands for Managed Long-Term Services and Support. That is a delivery system using what we call MCEs or managed care entities to coordinate the medical care as well as the long-term services and support for those people who are enrolled in Medicaid currently. Indiana has introduced this MLTSS program for Medicaid eligible Hoosiers that are 60 plus, and we call this Indiana Pathways for Aging. The enrollment in this process is underway, and as Cora says, we go live on July 1st. We also want you to be aware that included in this, the MCEs that participate in Pathways will deliver both acute and preventative care. So services that are HCBS, or a lot of people view as waiver services, would be considered currently A&D waiver services would be incorporated under this, as well as nursing facility services. Next slide. Whoever's doing slides are off. Okay, well, I'm just going to continue and they'll catch up with the slides. What is Indiana Pathways for Aging? Indiana Pathways for Aging, as I said, is a managed Medicaid program that is launching July 1st. It incorporates person-centered services and support, as well as focusing on enhancing smooth transitions and really honing in on access to services. And Pathways members can choose one of the 3 MCEs or managed care entities. That is either Anthem, Humana, or United Healthcare. Next slide. So who is eligible? We like to just kind of make sure everybody understands exactly who's there. This program is for those people who are Indiana residents who are Medicaid enrollees that meet the following requirements. They are over 60 years old or 60 and older who are eligible for the Medicaid programs. This may include those people who are eligible for full Medicare benefits, which we call dually eligible. Could be people who are currently residing in nursing facilities or individuals who are receiving home and community-based services, which currently are under the A&D waiver. Those people who are not eligible are those people who are under 59 or under, those people who are partially Medicare beneficiary dual eligible, people who are DDRS waiver recipients, including the TBI waiver, IDD residents in the ICFs, PACE residents, as well as several people who fall under the RCAP or the ESRD waiver, the MA 12 waiver. We just want to make sure that we have that level set. Next slide. So what benefits are available under Pathways? All Pathways members get what we consider state plan Medicaid benefits currently, as well as could qualify for what is currently called A&D waiver services. These services include hospital care, lab testing, surgical care, preventative care, primary care visits, pharmacy, prescriptions, behavioral health and addiction treatment, DME, home health, hospice, dental, vision, hearing aids, or NEMT. For those people in duals, this court is coordinated with their services that they get under the Medicare, but Medicare would be primary. So you would still be able to have that Medicare Part A, Part B, Part D, or Part C services in addition to the Medicaid services, but they would be coordinated, those benefits. Next slide. So under Pathways, the real focus is on the members and ensuring that they get the overall unified coordination of care. So there are different support levels, and we want you to be aware of it. We have enrollment brokers. Those are the whole team that is helping members when they're choosing their MCEs or coordinating getting them enrolled in one of those MCE programs. We also have another level of care coordination. All members will get a care coordinator that looks at the high-level coordination of care, trying to determine what is best fit and ensuring the members get the care they need. They are the ones who are focusing on that patient-centered care program processing. Then in addition to that, there would be service coordinators for those people who qualify and need those extra support of member waiver services. Those are community-based services. In addition to their health services, those people who would be on a traditional A&D waiver currently would also get a service coordinator. In addition to this, we have assistance in navigating between the Medicaid and Medicare benefits. All MCEs are supposed to help and assist with that, as well as we have resources within the state to assist with that, so that we are coordinating those Medicare and Medicaid benefits to maximize services available for our members. Another level of care is the member service support service vendor that we have, and we will have Shauna talk in depth on that later in this presentation. Next slide. So let's talk a little bit about the enrollment and the plan so that we have that. The enrollment activity that is currently occurring or has been is starting in May. All members received a 60-day notice of their benefits from FSSA. So you would have received it from or notifying them of the MCE that they either have chosen or were assigned to if they had not yet chosen. In June, they will be receiving, and some have already started to receive, those member welcome packets from the MCEs. The MCEs will be sending out member welcome packets to all of the members so that they are aware and which MCE they're assigned to, with details, information on how to contact them and their benefits. In addition to that, they also will be getting introductory phone calls from the health plans, starting with those people with the complex membership. So those people who are on complex membership will be definitely getting a phone call, but the plan will continue to reach out to members to get that transition all the way through go live. Starting July 1st is when the plan coverage starts. So that is kind of like our go live date. So that will be changing. Those people who are currently in a fee for service or HCC could be transitioned, and it would start July 1st. Next slide. So as I said, members received a letter in February and March notifying them of the pathways coming in place and how to enroll in a health plan. Those letters introduced the pathways helpline, and it focused them into the enrollment broker. So if any member still would like access to that enrollment broker, that phone number is 87-pathways-4. So you can still call and contact the enrollment broker, ask them about a plan comparison chart, talk through that process. Members who did not pick a plan by April 30th would have been auto-assigned. That auto-assign logic was set up as a mechanism to align your current Medicare Advantage or D-SNP plan with a Pathways plan, but then if not, would be randomly selected. Members did receive notices from the enrollment brokers starting in May, notifying them of their assignment. So if you are a provider or somebody supporting a member, you can always ask them to pull out or refer to that letter to indicate which MCE they are assigned to. Next slide. We really want to stress that member choice is the most important thing through this process. Members always have a right to choose their MCE health plan. They can, at the time, members, if they had not chosen by April, we did do an auto assign, but that does not mean that they cannot change. We do stress that we try to align your D-SNP or your Medicare Advantage plan provider with your MCE. That definitely increases the coordination of care through this process. Next slide. For those members who do choose to want to change MCE plans, we want to make sure they're aware of at what points that it is possible to do that. Within 90 days of the start of the program, which would be July 1st, members can change their health plan at any time. So if they go in and it's July 2nd and they choose to change their plan, all they have to do is contact the enrollment broker and do that. They also have an opportunity to change their plan at least once every calendar year. So that just gives them an opportunity at any point in the calendar year that they would like to change, they would be eligible to do that. Also, during the Medicare annual enrollment period, any member can change their Pathways MCE or health plan, especially to align with their Medicare Advantage plans or Medicare enrollment. They also have an opportunity anytime you have changed your Medicare plan, you will get that opportunity to also change your Medicaid plan to align to it. So if your Medicare plan and your Medicaid plan do not align, they can change. I do want to stress at this point, while we do want to coordinate that Medicare and Medicaid plan alignment, every individual can stay with the current Medicare fee-for-service and pick an MCE plan separately so that it does not force you to choose a Medicare Advantage or D-SNP plan just because you're in a certain Medicaid health plan. Lastly, that if you, for any just cause, members can choose to change their plan. So if they change their plan due to a quality issue, language issue, or any just cause, they have that opportunity to change their plan. Next slide. We like to give you an opportunity and resources so that everyone has the information necessary in that enrollment support and materials. So we want to make sure that all members, authorized rep, are aware that they can call in and assist the member through this enrollment or changing of plans. We have member educational webinars on the YouTube channel, so we please encourage you to use that resource as well. Pathways also has notices webinars, so we have different stakeholder engagement webinars that we've had throughout this year and will be going forward. And all of those are available on the indiana.gov website if you go to the Pathways and look at stakeholder engagement. Also on the website of the Pathways website, there's a ton of other resources, including FAQs and the health plan comparison. And at this point, I am going to pass it over to Gio so he can talk about care coordination.
Thank you, Kim. Hi, I'm Giovanni Bonilla. I'm the Director of Clinical Services for the Office of Medicaid and Policy. So lots of changes occurring to our members, right? So even though there's going to be multiple points, there's going to be multiple contacts, one of the great emphasis that we've had is to make this process more high touch, less tech. We rely a lot on technology today, right? But this is a population that's going to be undergoing a lot of changes. Not only going from one waiver to another, but from probably for fee-for-service to a managed care entity, having to, for the first time, have this really integrated delivery system. So part of the state's contract with the managed care entities is that all of the managed care entities must at least be able to offer two levels of services, of care management. One is care management, which is your traditional care management model. You have a care manager who's coordinating your medical care, your needs, your physician appointments, all those components, and also complex care management. There are particular individuals that will be a little bit more complex, that require a lot more intensity in the amount of touches. So care management, two levels have to be offered at a minimum. Also, for the members who are currently receiving any type of long-term services, and I know Kim spelled out the MLTSS and what those acronyms stand for, but those individuals that are residing in a skilled nursing facility and are receiving services, they're also going to need care coordination. Oftentimes, these individuals also need assistance, for example, going to their follow-up doctor's appointments for radiology, specialty appointments. Sometimes they have a lot of care needs that are outside of the facility, so they will have someone that's assisting with that as well. Or for individuals receiving home community-based services, the MC must provide service coordination, and that's in addition to the care coordination that they must provide. Under the care coordination model, under the service coordination models, members that are residing in the community and having complex cases as well, they should be managed, but also to ensure that all acute primary and home community-based services needs are being addressed and coordinated. So in the community, for example, there's a lot of individuals that are going to have tremendous needs, right? If they're residing in the community, we want them to be in their place of service. We want them to be where they want to reside. But oftentimes there's a lot of individual needs that need to be met, right? They're all medical in nature. So the process of this is not to address only the medical components, but the non-medical components, which includes environmental issues. Next slide, please. So under the service coordination model, to just give you a quick highlight, there's a lot of text here, is assessing, right? How can you determine if a home environment safety, for example, is it safe for an individual to be at home? How's the cluttering? If you're on oxygen, is the home properly equipped, right, to prevent a fire, for example, or an explosion of that oxygen cylinder? So the service coordinator is intended to be those eyes and ears of the care coordinator to be able to assess the boots on the ground. Also, for the members who are developing the long-term services specific service plan, coordinating with the skilled nursing facility what this member may need outside to enhance their quality of life, right, if they're residing in a nursing facility. There's a lot of components that the nursing facility that a member may need to improve their quality of life that are not necessarily reimbursed or provided by the skilled nursing facility. That's what the service coordinator will help assist to do. In addition, members who are determined to meet that nursing facility level of care and are receiving the home community-based services, or they're in an institutional setting, they are going to receive the services, right, to be able to allow them to meet those social needs as well. So all members will be receiving this care coordination as well as the service coordination as part of this model. Like Kimberly mentioned, some individuals will have both Medicare and Medicaid. This will be an example where, for example, if someone's residing in the community, Medicare does not cover, for example, personal care attendant services or home modification or handrails to be put on a bathroom, right, because of patients at risk of fall. This is where the service coordinator would evaluate that this patient could safely remain at home if we do some minor modifications to the home, and we are able to do though because the patient owns the home. So these are the kinds of things that will be happening in this care coordination model. Next slide, please. So in order for the managed care and this transitions to happen, and like Kimberly talked about, members are being outreached, right, based on their complexity. One of the things that's frustrating for healthcare consumers is when you go to the same facility, the same health system, and you see different doctors and they ask you the same questions because they can't read your chart. So we're trying to avoid that, right? So because we know a lot of our members, so the managed care entities have received and will continue to receive 6 months of data from the claims data. In our claims data, our managed care entities are able to see how oftentimes have you seen a primary care physician, have you seen a specialist? What are you seeing those? What are the diagnoses that you've been associated with? How many hospitalizations have you had? How many emergency room visits that you have? Those are indicators that you might be at a high level for risk of readmission or emergent care. Are you incurring high dollars? Anything over 50,000, right? What is going on with your medical condition? Because you might also require a little bit of more complexity in care management as well. We're also going to provide them, the AAAs are continuing right now, or updating their service plans. Those service plans will be provided to the managed care entity so they can see what this member had been receiving, what their care plans were, and what the care manager was working on. Also, the level of care assessments will be provided, and also existing authorizations that are under the medical in both the managed long-term services and home community-based services. This is really critical because the managed care entities will know what services have already been authorized. When the member transitions to managed care, those authorizations will be entered into the managed care entities, and those authorizations will allow the providers to continue to bill for the services. One of the critical things that's important for our providers, if you're in doubt on the first week in July, before you submit claims, go ahead and for any claims of days of service July 1st or forward, go onto the provider portal, verified eligibility. You'll be able to see who that member has been affiliated to from a managed care perspective, because all claims from 7 on forward should be going to that managed care entity. But those authorizations are still valid. So for example, there might be instances where we approve a home or a vehicle modification at the end of June, but the actual pricing, bidding, and quotes don't come in until July 5th. On July 5th, that coordination should be happening with the managed care entity so that our providers are able to bill for those services accordingly. But the managed care entities will know that we've authorized that home or vehicle modification. So that's just an example. The same thing if you're providing home health, right? And your home health authorization goes until August. For all days of services of June 30th and below, you would bill the current payer. As of 7/1, you would bill the appropriate managed care entities, right? So that's the kind of coordination that we want to make sure that we ensure that our managed care entities have done that. So one of the things that our MCs have started to do, next slide, which is what Kimberly sort of already spoken to, a lot of member outreach, not just through technology, but actually human beings. In many instances, these are the service coordinators and care coordinators that'll be caring for the members with the welcome packets, introductory phone calls, reviewing the service plans to make sure that the service plans are up to date. But are there any things that are changing in the patient's condition that the managed care should be aware of? A lot of provider engagement is starting. Continuity of care authorizations, as we mentioned, will be transitioned and issued by the managed care starting on 7/1. Coordinate care is required by the established service plan. So all of the care that is the members currently receiving will be honored by the managed care entities in transition. And there'll be continued engagement. And I know that Holly has some additional information and others will do. So there's a lot of thought that has been given so that members don't feel that the managed care entities that are going to be caring for them don't know who they are. There's actually going to be a profile, a member knowledge that the managed care entities will have that are going to feel these members that they're really being cared for, and they're going to be handed off smoothly to someone else to manage their care. So with that said, I'm going to pass it on to Shauna now, and she's going to be discussing the support services that will be available.
Hi, good afternoon, everyone. My name is Shauna Frazier, and I am the Enrollment Vendor Manager with OMPP. I'm going to give you a brief overview of the member support services that will be available for Pathways members. So starting July 1st of 2024, members, member advocates, and caregivers will have access to a member support services vendor. This is in addition to the long-term care ombudsman. The member support services vendor will provide direct assistance in navigating Pathways coverage and will help to resolve any issues that members may experience while in the program. This does not replace the support members will receive from their MCE, but it adds another layer of support when members need it. Examples of assistance member support services can provide include educating members on managed care and how to access services, assisting members experiencing issues on accessing care, ensuring the member voice is being upheld in person-centered planning in care and service coordination, supporting the member in navigating issues with their MCE or providers, and providing education on the grievance and appeals process, as well as assistance filing a grievance or appeal at the member's request. Starting July 1st, members will be able to reach the member support services vendor by calling 877-738-3511 or by emailing Indiana Pathways MSS@maximus.com. The phone line will operate Monday through Friday from 8 a.m. to 8 p.m. Eastern Time. There will also be a website, IndianaPathwaysMSS.com, that will provide information about member support services, the Pathways for Aging program, and the different services available under the program. The phone number, web address, and email address will be added to the in.gov/pathways website for quick access. Again, members can reach out to member support services starting as of July 1st for any questions or assistance they need, but we always encourage members to work directly with their MCE first. Now I'm going to turn it back over to Kim to discuss provider information.
Thank you, Shauna. So we just want to give you some background and information on how do providers contract with the MCEs. Currently, just as a reminder, Pathways is an open network, so we are requiring all willing MCEs to contract with all willing providers. So if you're a willing provider who is a HCPS licensed provider, you can register to become contracted with the MCE. To contract, they currently are taking contracts, as we said, it's underway. You go directly to the MCE website to be able to contract. If you have any questions, you can also contact each of the MCEs at the attached email addresses to get more clarification. We do have a detailed MCE contracting webinar available. You can go to indy.gov/pathways/stakeholder-engagement to review that. And that has a very specific in detail information on how to contract with the MCEs. Next slide. So we also want to make sure you're aware all three of the MCEs have a provider manual available online. If you want to go to any of the links that are attached to this presentation, or you can go directly to the MCE website and search for provider manuals, pathways, Indiana Medicaid pathways, provider manuals, and you will be able to find those. I'm going to pass it over to Holly Cunningham Pickett to discuss the claims testing.
Thanks, Kim, and good afternoon, everyone. I am going to talk a little bit about Senate Bill 132, which was proposed and passed during our latest Indiana General Assembly. This bill required OMPP to put together a provider claims advisory group so that we could talk and figure out where some of the pain points are between what is done today in fee-for-service versus how the MCEs process claims. And it also required OMPP to do a test claims window period so that providers could work with the MCEs on submitting claims and we could work with the MCEs on catching anything that maybe wasn't configured correctly in their systems or identify training needs that we might need to do with the provider community at large. We, as a result of our advisory group and the requirement to set up a claims testing window, we had 2 claims testing periods. One we had the first one that started on April the 29th, and basically we just ended with the second one on May 31st. So the MCE and providers who registered and submitted claims testing, the MCEs are still processing a lot of those claims testing because unfortunately, when we're not in the real production mode, it's a lot of manual work. But as a result, the MCEs are reaching out individually with providers who maybe had struggled or had rejected claims or denied claims to offer education. And then providers who submitted claims and they went through and processed correctly, then they are getting an email back saying that they passed and will be are approved to receive emergency financial assistance if after go live they run into claims payment issues with the MCEs. And that was the other thing that Senate Bill 132 provided for, was that there would be a period of time that if there are issues where the providers run into claims issues, then the MCEs could provide some financial support and then reconcile that financial support once they got the claim issues resolved. So the work group that we've convened, it contains 2 nursing home chains. It contains a hospice provider, a couple of home health providers, a couple of waiver providers, and we meet weekly to talk about where we can help provide more assistance, provide better support so that we don't run into claim submission issues after July 1 go live. So we have about 4 different things that the group is charged to do. The first thing is to work, and the MCEs are also part of this group as well as OMPP. And so the one thing is for this group to help identify what is a uniform billing format that the Pathways MCEs, all 3 MCEs have to follow, so that we don't have one MCE requiring these billing elements and another MCE requiring different billing elements to get your claim submitted. We are taking all of that and we are going back to the NCs and telling them that they all three have to do the exact same thing. So we're in the process of doing that. We're about 75% done with this process, and we should have a uniform billing format and instructions on and a training guide for providers on how to use that, the MCE's billing format out here in the next couple of weeks. We are also seeking feedback from our claims advisory group on how the claims testing is going and where they've run into issues and what we need to do to address those issues. We're through that process also identifying where we need to provide additional education and training needs to our providers so that this is not a difficult process for them. We are identifying a policy that outlines what it means to submit a claim appropriately. And then lastly, the group will be putting together the parameters for the providers who have participated in claims testing and then after go live may require additional financial assistance. What does that program look like, and how do providers request that information or request that financial assistance? There were some MCE jointly hosted webinars that our MCE partners did during the claims testing period. And there's a link here in this slide that you'll be provided with that you can click on if you would like to view what those webinars were all about. Next slide. I'm going to go into now our Pathways Readiness Review. I don't know how familiar our audience is with what readiness is, but we, anytime we procure and award and then implement a brand new contract, we go through a readiness process with our managed care entities to make sure that they are ready day one to take the new enrollment of the Medicaid population that they are now going to serve. It's a very long process. It usually goes on for a year, sometimes longer, but we start reviewing thousands and thousands of documents, policies and procedures, member materials, provider materials. And then we also go on site monthly to the MCEs, and they have to demonstrate the different systems that they use to show us that they're meeting contract compliance and that they're ready to take that membership starting July 1. We started the Pathways Readiness Review in July of 2023, and we just ended at the end of May this past month. And so what we, if you want to go to the next slide, I believe. Actually, could you go to 31? Sorry, Katie. So, so what we've done is that through the end of May, we've assessed 256 readiness review requirements that they had to meet over this probably 11-month period. And by the end of May, all three MCEs have achieved 100% compliance with the contract and each of the readiness requirements. So now we will send CMS a report to show all of the different requirements and how the MCEs did, and that will go out this month. Part of readiness, and then even part of Go Live, is that we have set up regular touch points with the MCEs. We started in May, at the beginning of May, to make sure, again, that everybody's ready. This is not necessarily a step of readiness. This is more of a step of Go Live, but we have ongoing systems, meetings, touch points weekly to ensure that they're getting the files the way they should be, that they can access the different systems that they need to be accessing, and that, you know, come July 1, we should be able to jump out of the gate and have no systems issues. The same thing with quality. Quality is having a stand-up meeting every week with the MCEs to discuss incident reporting and regulatory reporting and the different quality strategies, so that come July 1, the MCEs are prepared and know what they should be doing regarding quality. We're also doing a twice a week meeting regarding care coordination and service coordination. A big part of that is how we are going to handle the transitions from A&D waiver to the pathways waiver. There's going to be changes in individuals' current waiver case managers. They'll be moving to service coordinators with the MCEs. Several individuals will be. So it's, identifying who the current waiver case manager is and who the new service coordinator is, and how will that outreach look for those members and those case managers. We're also identifying complex cases that are coming in from fee-for-service to the managed care entity so that they can know who they need to give attention to right away. And so that's all being discussed during our care coordination, service coordination meetings twice a week. And then we have a provider meeting, a network adequacy and provider contracting meeting twice a month, where we are reviewing where MCEs are with contracting and where they're at with provider adequacy. We will continue to have these stand-up meetings post go live. And we will also continue to do regular monthly audits and review with the MCEs regarding regarding all of the topics that we kind of covered during readiness. So, they showed us their systems during readiness in their test environment. Now we're going to have them show us their systems and go live using real members that we've assigned to them so that they can show us that their systems are doing exactly what they said they were going to do. Next slide. Okay, and now I'm going to pass it to Ashton.
Thanks, Holly. Hi, my name is Ashton Driscoll. I am the LTSS Senior Provider Relations Specialist with OMPP. I just wanted to do a brief overview of the resources that are available on our Pathways website. So if you go to www.in.gov/pathways, you'll see a few tiles that are available for different stakeholder types. Those tiles will take you to different resources that are available, such as our plan comparison, general FAQs, our promotional toolkit, and our plan selection notices. That promotional toolkit has things like brochures, as well as commercials that we've had about Pathways that you can view, and our general FAQs, if you go to the next slide, cover things like our general program, service plans and processes, claims and contracts. We also have different FAQs for HCBS providers and nursing facilities. And also on the left-hand side, when you go to the website, you'll see a tile that says Stakeholder Engagement. That is where you will view all of our past announcements and webinars. Next slide. And I'm going to pass it back over to Cora.
Great, thank you so much. Appreciate the Medicaid team's presentation today. So with that, I want to thank all of our attendees today. As you can tell, there's a lot of activity happening in this space. Given the size of this particular webinar, we weren't able to take Q&A live. However, this recording and the PowerPoint will be posted on the in.gov/pathways website at that stakeholder engagement page that we've referenced several times now. You can also see prior webinars there and a number of presentations, particularly if you're a provider. A couple other things that I just want to highlight for you all is, particularly if you are a waiver provider and are not currently signed up for our IHCP bulletins and provider listservs, really would encourage you to go to the Medicaid IHCP page and make sure that you are signed up to receive those Medicaid bulletins, where we provide official provider notice of upcoming changes, and we'll continue to provide links and information about the Pathways program via that channel, as well as, of course, the Pathways website. If you're a Medicaid member or you're a community organization who works with Medicaid members, please keep your eye out for the welcome packet that the plans are currently sending out in the mail, because that will include really critical information about the plan, including how to contact the member services phone line, which are now available for Medicaid members to call and get information about their plan. Anthem, United, and United Healthcare. All three are now live. With that, leading into the July 1st go live, as we mentioned, there still is an opportunity to select a different plan. And so by contacting the enrollment broker at the Pathways phone number that we provided and that is on our website, you can make that change if you or the member that you're working with is interested in doing so. Additionally, there's general information that phone line can provide you if you're not finding what you need on the website. So again, we're really pleased with the activity, particularly in the last week with both our CMS approval and achieving 100% readiness with all three managed care entities. So we look forward to launching this program in 24 short days and appreciate as stakeholders all of your collaboration and partnership in doing so. So again, thank you for joining us for your Friday afternoon lunch hour, and we look forward to connecting with you all soon. Thanks and take care.